Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Role of follicular stimulating hormone. At puberty, hypothalamus pituitary ovarian axis becomes functional. Hypothalamus produces gonadotropin releasing hormone in a pulsatile manner. This gonadotropin releasing hormone activates the anterior pituitary. So the anterior pituitary will release the follicle stimulating hormone. Functions of follicle stimulating hormone. It prevents the follicles from undergoing follicular stimulating hormone prevents the follicle from undergoing atresia and it stimulates the follicle. Role of follicular stimulating hormone. Follicular stimulating hormone acts on granulosa cells and it gives rise to two things. Follicular stimulating hormone acts on granulosa cells and leads to the production of estrogen and inhibin B. Granulosa cells will produce estrogen and inhibin B. Inhibin B has negative feedback on follicular stimulating hormone. That is, inhibin B inhibits the follicular stimulating hormone. Now, estrogen. Estrogen has negative feedback on follicular stimulating hormone. So, this will result in decreased follicular stimulating hormone. When there is decreased follicular stimulating hormone, all the follicles will die except one dominant follicle. That is the follicle with maximum FSH receptors on the granulosa cells becomes the dominant follicle. Second, estrogen has positive feedback on luteinizing hormone and thus estrogen increases the luteinizing hormone. Estrogen also proliferates the uterine endometrium and it never gives so, because it proliferates the uterine endometrium, we should never give estrogen alone to a female with intact uterus because estrogen can cause endometrial cancer and endometrial hyperplasia. Note: follicular stimulating hormones are present on granulosa cells. Granulosa cell tumor of ovary is a feminizing tumor of ovary. Tumor markers of granulosa cell tumor of ovary is inhibin B.
granulosa cell tumor of the ovary. Actually, granulosa cells contain follicular stimulating hormone receptors. So, as a result, the tumor marker for granulosa cell tumor of ovary is inhibin B because inhibin B is produced by follicular stimulating hormone. Then, whenever there is negative feedback on FSH, this will all the follicles will die except one which is dominant follicle. Because on the dominant follicle there are a lot of FSH receptors. So as a result, this one dominant follicle is the one which survives, whereas the other follicles will die completely. Thank you and thank you for watching.